thank you so much for coming to our MSP Wellness information session on this snowy Tuesday morning. I know it's been a chaotic one for me and folks in my office with internet outages and all sorts of things. So I really appreciate you all taking the time to be here and to learn more about MSP Wellness today. I'll just take a moment to introduce myself. My name is Frances Huntley. I am the Strategic Partnership Program Manager at the Minneapolis Regional Chamber. And together with Christine Levins, I manage and lead the MSP Wellness Initiative, as well as other emerging initiatives of the Chamber that are really focused on providing resources for employers across the region and strengthening the business community as a whole. I'm relatively new to the Chamber. I started this role in July, and I'm just really excited and inspired by the MSP Wellness Program and the mission and the partners that we work with. It's been a truly wonderful thing to be a part of, so I'm really excited to get to talk to you all about that today. Amy, would you just advance to the next slide, please? Thank you. Christine Levins, whose name is here, had planned to be on the call today, but as I mentioned, she is in the Chamber's downtown office, which is experiencing a big internet outage today, so she's not here. But she's been leading this work since its inception and is a great leader in this space. So we're just very fortunate to have her leading this work. And Julie Tower is also with us from Health Partners, and we will introduce her in just a few moments. We'll go ahead and move to the next slide and just look at our agenda briefly. I'll talk briefly about MSP Wellness as a partner and initiative, and then we'll hear from Julie Tower over at Health Partners. And then we'll get specifically into some of the tools and upcoming opportunities that'll be offered through MSP Wellness this year. And then, of course, we'll save some space for questions at the end. So please do utilize the question chat feature here to ask questions as we go, and I'll look at those at the end and answer them as best I can. So we'll go ahead and move to the next slide. I think many of you here today are familiar with MSP Wellness and perhaps are champion organizations or have worked with us in the past. But just to introduce this for folks who might not know, MSP Wellness is an initiative of the Minneapolis Regional Chamber, and we do this work in partnership with Hennepin County Public Health, the Minneapolis Health Department, and Health Partners. And we really seek to meet employers where you're at in terms of employee wellness and provide resources, technical assistance, and programming to help you cultivate a culture of wellness at your workplace. This has been a really exciting year for MSP Wellness because we've really scaled the work and gotten aligned with our partners to execute efficiently and effectively, and we're really excited to continue to grow this initiative and continue to help organizations like all of yours. So Amy, I'm gonna have you go ahead and switch this presentation off for a moment and let Julie pull hers up while I introduce everyone to Julie Tower. Julie's here today from Health Partners. She's gonna introduce you all to Living Well, which is a wonderful addition to the MSP Wellness platform and a really great employer resource. We've been working with Health Partners for about a year now, I think, and it's been great to work with them, with Julie, and have that expertise at the table. So Julie, thank you for being here. I'll go ahead and pass it to you.
Thanks, Frances. And I just want to make sure you can see that slide. Great, thank you. So good morning. I am Julie Tower, as Frances mentioned. I'm really happy to be here this morning talking about our Living Well community solution, which is part of the MSP Wellness partnership, as Frances was mentioning. So, what is that? I think that's the first question that I usually get is, what is that Living Well community solution? So Living Well is our well-being platform, and the community part of this solution is where employers across a community work together to address overlapping health challenges and barriers to productive teams. So really aligning those employers with concurrent campaigns, which then increases the likelihood that whole families can really engage in activities together and really can multiply the impact of the employer's well-being investment. So really excited to be a part of this. So we're going to advance the slide. Let's see, there we go. So want to talk a little bit about what is driving healthcare costs. And so I don't think this is going to be surprising to anybody on this call, but these are the health issues that we see at Health Partners and across the country that are really driving healthcare costs. So musculoskeletal disease, heart disease, mental health, and diabetes. So we also know that these conditions are largely treatable through lifestyle improvements. So healthy habits, healthy environments. And that's where the well-being program comes into play. So again, that community solution is just taking those strategies, those initiatives, those activities that reduce risk in these areas and coordinating them throughout, throughout a community. We've also done the research here at Health Partners, so we're really, it's great to be a research, care delivery, and health plan system. So we have lots of data. So we've done the research, and we know that more than 50% of participants who exhibited risk for stress were able to actually remove that risk over the course of a year by engaging with Health Partners Living Well activities. So that tells us that our activities are effective. We also know that nearly 4 out of 5 participants improved a lifestyle risk factor, like low physical activity or too little fruits and veggies, or actually removed a lifestyle risk factor like being overweight or being obese when participating in our Health Partners Living Well activities. So again, really proud of that, and it makes us a really well-rounded, comprehensive solution. Let's talk a little bit about kind of where the solution came from and how we, how at Health Partners, how we built Living Well and why we think that it is probably one of the best solutions out there. So Living Well is based on a really simple evidence-based framework, which leads to optimal results. So first, all of you, leadership. We know that when leaders are engaged with well-being, good things happen. And we will work, Health Partners, we will work with leaders to ensure successful implementation. So all along that implementation process, and then through program participation, and then kind of planning for the next year, you have a partner through that whole time frame. Environment is also really key for well-being. And so our Living Well solutions helps employers create environments that make healthy choice the easy choice. So, you think about vending machines and what's in your vending machines, or, how your work desk, your workspaces are set up. So those types of environmental things that impact your employees' productivity and well-being. So last, though, we will help employers engage and keep participants engaged throughout the program year through personalized messaging that really resonates with your organization and with your employees. And we'll talk a little bit more about that in a minute. So we've done a study, of course. We've done a study with 16 of our health plan customers, because we wanted to see if that framework that I just talked about, if it really works. And so we evaluated how closely their employee well-being programs aligned with that framework. And then we looked at their claims trends over the last 4 years. And what we found was that really affirmed, I think, what we were assuming, but we wanted to make sure that when we have a comprehensive health and well-being solution and you leverage best practice, it works. So the groups with the most comprehensive well-being programs that followed these best practices consistently outperformed the others when it came to health outcomes, and that as demonstrated by their claims experience. So we can help you develop that comprehensive and effective best practice health and well-being program that measurably And I think that's the key, measurably boosts employee wellness, productivity, and the bottom line. So all of your colleagues come to work with a different lens through which they are experiencing the world. And our community living well solution has activities and engagement strategies and communication options for everyone. And we really want to make sure that we're meeting people where they are, no matter where they are in their life or in their healthcare journey. So let's just talk a little bit about why this community partnership is so important and how it's different. So first of all, by leveraging technology, so shared resources, leveraging technology, marketing, and communication resources across multiple groups at the same time, we can create those concurrent, coordinated community campaigns. So I think a great example of that is our Make It Okay campaign. Make It Okay is a phenomenal campaign that we Health Partners started 10 years ago. But it really just was amplified when more than one organization, started to take hold, embrace that message. And it has just amplified, and it's just amazing some of the results that we're seeing with that campaign. The community approach is also important because it creates that surround sound type of experience, so that messages that, maybe my husband is hearing at work or my children are hearing at school, maybe it's the same message that I'm hearing at my workplace or in my community with my community activities. And so we know repetition is key, kind of as messages sink in and activate people to change. So how cool is it if you're sitting around the dinner table or you're sitting at a sporting event and you're all talking about the same wellness campaign? And that's pretty cool and that's pretty powerful. I think the most important point on this slide, though, is equitable access to well-being resources. So at Health Partners, and we're a mission-driven organization, just like the Chamber, and I'm sure all of your organizations too. And cost should not be a barrier to well-being. And so through this community partnership, excuse me, we are extending the same affordable pricing to large and small employer groups alike. And so I'm going to talk about that here in just a second. So I'm going to talk about the different levels of experiences an employer could opt into if this community solution is something that is interesting to them. So we have different experience levels. Step one is what you're seeing on the screen right now. The foundational experience. This is our base experience. This is our access to our digital platform. This is where you'll find community-tailored communication toolkits to engage your employees. There's reporting, monthly and then annual aggregate level reporting. So how is the community doing and how are you doing in comparison to that community with your well-being metrics? In addition to participation in committees and partnerships across the community. And then finally, there are some customizations available at this level with the website experience. The next level is an enhanced living well level. And this is just building on our foundational experience. And essentially, you'll see there that we're adding some strategic consultation and reporting capabilities, in addition to reward and incentive administration and management. So one more step up from that base experience. And then the last level is that enhanced living well with a really high touch coaching experience. So in this level, you can opt to bring coaching into the experience in addition to high risk outreach. So again, something for everybody, and that's where the employer, the group can really figure out what is it that we're ready for. And so happy to talk through any and all of these should you be interested in learning more. Pricing. So I'm not going to go into detail on all of the pricing. I know Francis mentioned that these slides will be available, and we'll make sure that they're available to you after this presentation, so you can have this information. But this is what our pricing looks like. The foundation experience, and that you'll see is really, it's for any employer, any size. You can have less than 10 employees. You could have over 500 employees. So any size. Enhanced Living Well and Enhanced Living Well with Coaching, those are for those mid to larger groups. And so you'll see that requirement there. And then there's different models that we have that you can select from. Again, trying to figure out what's right for you, what's right for your population in terms of incentive management and personalization, actually, and customization. So those are those different models. And again, I'm happy to give you a lot more detail if you'd like that after the presentation. And then on the bottom, you'll see the Employee Assistance Program. So we also have an EAP that is available. It says 10 plus contracts there. Really, I think any size is what we can extend that. If that is something, happy to talk to you about that too. But let's talk a little bit more about the experience and what this looks like if you've got an employee that is ready, if we've implemented this and your participant, your employees are engaging in the experience. So there'll be a unique web portal that your participants would have access to, and that's where all the activities sit. And so it's one-stop shop to the Living Well activities, the community activities, and then any of those customizable links. So you'll see in the middle there, this one just says Health Partners, but on the pictures, actually on the right and then in the middle, you'll see Health Partners logo up there. If you were to participate in a community living well solution, we would co-brand if that's what you'd like. We'd co-brand with you, so we could put your logo up there as well. We can customize the language on the landing page. So where it says welcome Mason, it could say, welcome, whatever the name of the participant is that is logging in. And then there'll be some customized language under there, and we work with you on what that would be. And then the same thing in the middle is just that first time log on language, and we can customize that with you as well. And then lastly, the health assessment. So we have tailored health assessment modules that we can make sure that we're designing the health assessment that is right for your population. And there's a variety of ways we do that. The health assessment really is the key to unlock the data. How healthy is my population? What are the concerns? Where should we focus? So that health assessment is really key. Not going to spend too much time on this slide. What do we offer and how do we offer it? There's all of the well-being activities that you see there. Complex condition management, employee assisted EAP. I already talked about nutrition, physical activity, sleep, tobacco and vape use, weight management, and more. So there's really trying to get to those core behaviors that drive those health outcomes we talked about earlier. And how do we offer it? There's a variety of channels that we can use. We're excited to really integrate with trackers like the Apple Watch. We can now integrate that with our experience, so we can track steps, for example. So really some cool things that are happening there. And 95% of the participants that participate in our programs are satisfied with the activities they engaged in. So again, that tells us that our activities are doing well. They're effective and they're meaningful. Just a couple more slides and then I'll wrap up. So communication, we know, is really key to engagement. So if you think back at that framework, engagement is really key. So how do we do this? So we've developed turnkey toolkits, communication toolkits, because we know that employers, HR leaders, C-suite, people are busy. And so we've developed these communication turnkey toolkits to make this super easy. So there's automated engagement emails to remind participants to take or finish their health assessment, for example, or remind people to do their well-being activities. And in fact, as you can see on the banner down there, our communications have become so popular at driving engagement rates that we're really excited to share. Our average open rate is more than double the industry average. So I think that is, again, we're proud of that. And then, the other thing I wanted to mention on this slide is just that social determinants of health. So we know that people who are struggling to buy food or pay their rent, or they have other, foundational issues, very challenging to engage them in other well-being exercises or activities. So we're really excited with our solution to identify those individuals in your organizations, and there's probably more than you think, that maybe are struggling with basic needs. And then we can have outreach capabilities to make sure that they're connected to the resources that they need. So I think that's one of those enhancements that we're really excited about. So I will just wrap up here. We know that all of you, like I said, are busy. And we also know that now, probably more than ever, we need, our employees need, our communities need well-being resources. We feel like we've removed that cost. We removed the cost as a barrier so that everyone can participate in these really simple and effective programs. So I would just invite you, if you would like more information, we'd be happy to put a proposal together for you after we really understand your needs, and get back to you ASAP. And you can have the email right there. That email will go right to my team, and we'll get started on that for you right away. So thank you for your time and your attention today. Francis, I'll turn it back over to you, and be well.
Wonderful. Thank you so much, Julie. If anyone has questions for Julie specifically, please go ahead and put them in the chat, and she can definitely answer those at the end. So next, I am going to introduce everyone to the newest facet of the MSP Wellness program, which is the Employer Resource Hub. Amy, if you'll just go to the next slide. Perfect. This new Employer Resource Hub was just launched in October last month. It was a very exciting moment for us at the Chamber. This is a first iteration of a resource hub for employers to find information and assistance to help you develop or improve your employee wellness programs and really establish that culture of wellness at your organization. So in this hub, there's a few different tools with different sets of resources. There is the Employer Resources tool, where you'll find a set of curated health and wellness organizations, links to those websites that offer evidence-based resources for employers. And then there's a library where you can find specific educational materials according to the category that you're looking for. So you can use the search filters there and find topics like healthy eating, mental health, commercial tobacco cessation, and narrow down to the kinds of things that you're specifically looking for. And then you'll also find a set of educational webinars from those same curated sources, and they're also tagged according to those topics. In the next several months, we hope to be able to offer advising services as well, free of cost, where we'll have a set of vetted and curated consultants who can guide you in implementing policies and best practices around employee well-being. So please do go take a look at the Employer Resource Hub. Go to mspwellness.com and click Join the Hub. It'll ask you a few short questions so we can understand who is utilizing the resources and make sure that we continue to design with the audience in mind. And then please also share your feedback with us. We'd love to hear what resources you found most helpful and what you would add to the current list. We'll go ahead and go to the next slide, and I'll just talk briefly about a couple of upcoming opportunities that we'll offer through MSP Wellness at the start of 2023. These are both programs that were offered last year and will be offered again next year, and they were both a really great success last year. So we're really excited to get to help organizations with these tools again. The first is the Minneapolis Microgrant Program. This program is being offered through funding from the Minnesota State SHIP program via the Minneapolis Health Department and the Chamber. And the grants are offered to small businesses in Minneapolis to help them support employee wellness in the areas you see here. So healthy eating, physical activity, commercial tobacco-free living, breastfeeding support, and overall well-being. And not only does this program offer monetary funds to implement these new systems and policies, but we really provide that wraparound support in the process to make sure that you're able to implement policy systems and environmental changes that can be sustainable and effective in the long term and improving employee wellness. We had some great projects that got implemented this year through these grants, and it was just so fun to watch those projects unfold and work with those folks and see how those grantees were really making some positive changes for their employees. So we'll be launching the program right at the beginning of January and opening the application for folks, and we'll be hosting a couple of short virtual information sessions on January 9th and January 25th. If you'll just go to the next slide, Amy, we'll talk more about eligibility and process and make sure that you're all set up to apply for those and understand what's entailed during those January information sessions. And we'll send a follow-up email after today with links to register for one of those sessions if you're interested in learning more. And then lastly, we'll move to the last slide. We also have the MSP Wellness Champion Designation Program that will launch in February. This is probably the facet of the MSP Wellness initiative that most folks are most familiar with. In this program, we recognize and celebrate organizations who work to positively affect the health and well-being of their employees and communities. And we do this work in partnership with the Hennepin County and City of Minneapolis Health Departments. We have an application process that lays out a set of criteria that organizations need to meet to be designated a champion. That application will also open in February, and again, we'll do a couple of information sessions to help folks learn more and understand that application process. So be on the lookout for more information on that as we get those things up and running. You can always check for information on mspwellness.com. We'll post our upcoming events and our applications there. So with that, I'll start wrapping up here. I'll just take a moment to see if we have any questions in the chat right now. If you do have a question, please go ahead and enter it in the chat. I'll just pause for a moment to leave time for those. And if there are none, we'll just wrap up in a moment. I see the question for the link for the Employer Hub. I'll go ahead and grab that, and I will be putting it in the follow-up email today to all the folks who attended here. I also see this question about the champion application and wanting a follow-up. And yes, I think we would absolutely love to connect with you. And that is the intent of this program, to be able to also shed light on, strengths and opportunities for organizations. So um, I'll have my contact information in these slides that I send out later today. And if you would please send me an email, I'd love to follow up with you and have a conversation about that. Thank you for asking that. All right, well, if that's it, I just want to say again, thank you so much to everyone for joining us today. I will send a follow-up email with slides and contact information if anyone does want to follow up, has any questions. And thank you again. Enjoy the rest of your day. Bye-bye.